Over your working life, you've probably had to spend many uncomfortable days in bed, suffering from a rotten cold, the flu or some other infection. It's a staggering statistic, but in the UK, colds and respiratory infections account for 50% of adult absenteeism from work. Another favourite is the dreaded bout of painful food poisoning. Your continuing good health and fitness is an important part of the success and effectiveness of the company you work for. Ill health at work will not only lower productivity, but it can also pose safety problems, as ill personnel are sometimes less able to concentrate on the job at hand. We can all play a part in helping to prevent the spread of disease in our work environment. This video will help you understand more about the types of illnesses and infections which you can be exposed to both at home, when you go out, and when you are at work. We will look at how germs which cause infection are spread, and how best to control the spread of infection by improving workplace hygiene and guarding against possible contamination. We will also look at how your overall fitness and health is a vital element in preventing the spread of illness and disease. Before continuing, pause or stop this video and think about the number of days' work that you have lost over the past 2 years due to an illness caused by a cold or some other infection. Now let's take a closer look at some of these disease-causing germs. Germs, such as bacteria, are all around us, in the air we breathe, on the things we touch, and in the food and water we put in our body. In a sense, we are one big, breathing, walking germ. So let's then look at what has to occur for you to be infected by some of these germs. Firstly, there has to be a germ that can cause infection. General groupings of germs or infectious agents include bacteria, for example, Salmonella and E. coli. Viruses, the most common of which are colds and influenza, but which also include infectious diseases such as hepatitis and AIDS, and parasites and fungus. Bacteria have a bad reputation because they are known to cause disease, but most bacteria actually perform useful biological functions completely harmless to man. It is the disease-causing bacteria which you need to guard against. They can cause illness either by damaging body tissue or by releasing powerful chemical poisons called toxins, which are the main cause of food poisoning. Bacteria reproduces itself by simply splitting in two, and in the right conditions it can multiply at an alarming rate. Viruses are very tiny organisms. Essentially, they consist of a DNA gene surrounded by a capsule of protein. Viruses work by invading the cells of the organism they are infecting. When one of your cells has been invaded, then it is instructed by the virus to make other viruses, and in this way it reproduces itself. Viruses cause colds and influenza, and they are so prevalent that at this very moment at least 1 in 10 people throughout the world will be suffering from a cold or some strain of influenza. Less common, but more serious, are viral infections such as hepatitis A and B and AIDS. We will look at these in more detail later. The second thing which must be present for someone to get an infection is a form of transmission or vehicle to carry the germ. We can carry germs to our body by touching contaminated surfaces or objects and then touching our mouth, nose and eyes. Bacteria may enter our body through contaminated food or water, through broken skin, or by being breathed in, especially in the minute droplets of water which are pushed out of our lungs as we breathe, or which are shot out at great pressure by coughs and sneezes. Viruses, such as colds and influenza, are also transmitted by people coughing, sneezing, talking and laughing. The cold virus is found in very high concentrations in nasal secretions. As a result, many cold sufferers transmit the virus from their nose to their hands, which then come in contact with other people's hands. If these people in turn touch their nose or mouth, then infection can occur. Handled objects and food can also transmit the virus. Be aware that cold viruses can survive outside the body for 2 to 3 hours. But if you have the flu, then you need to be even more careful, as the virus survives outside the body for up to 72 hours. For this reason, it is vital that you wash your hands thoroughly after blowing your nose or coughing. Infectious diseases can also be transmitted on dust particles, by waste products of the body, and of course by insects. Hepatitis is a highly infectious viral disease involving inflammation of the liver. The virus is transmitted in blood, in feces or saliva. The two main types of hepatitis are hepatitis A and B. Hepatitis A is normally transmitted by contaminated food or water. Hepatitis B is most likely to be transmitted in infected blood or contact with infected body fluids, such as semen or saliva. The human immunodeficiency virus, which causes AIDS, is most likely to be transmitted by contact with contaminated blood or semen. There is no evidence to suggest that HIV can be transmitted by casual, non-sexual, person-to-person contact in any setting. Let's quickly look at how a blood-borne disease, such as hepatitis B or AIDS, could be transmitted in your workplace. If you rush in and assist a workmate who has suffered a cut, then you could be infected unless you take sensible precautions. Remember that infected blood could contaminate you through an open cut, skin abrasion, even dermatitis and acne, as well as through the mucous membranes of your mouth, eyes or nose. Indirect transmission by touching a contaminated object is also a danger. This is especially so with the hepatitis B virus, which can survive in dried blood for over a week. You must therefore thoroughly clean and disinfect an accident area without delay. Hygiene is one of the most important ways of maintaining good health and reducing the risk of infection. Learning and practicing the basic rules of hygiene is therefore a vital part of protecting not only your health, but the health of your fellow workers and your family. Take a close look at these situations and see if you can pick the hygiene and health problems. You will all know how important it is to wash your hands after going to the toilet. Bacteria from feces or urine can be transmitted through tissue paper onto the hands. Always wash your hands in warm water and soap. And don't do that. Use disposable paper towels or hot air dryers. Avoid using a communal towel at work for drying hands. Bacteria and viruses can spread this way. When eating or preparing food, either at work or at home, there are some important hygiene rules to remember. If you have touched your nose or mouth, don't then handle someone else's food. Before handling food, make sure you wash your hands thoroughly, especially if you have a cold or some other infection. Try and avoid cross-contamination between meat and cooked food or fruit. Raw food, particularly chicken, may harbour dangerous bacteria such as salmonella, and your hands can easily carry these germs to other foods. Fingernails may also harbour bacteria, so keep them short and clean. Cuts and sores should be covered with clean, waterproof dressings. Cracks and chips in your work mug or plate are a no-no. They can harbour bacteria, so be careful. Undercooking and not thawing food for sufficient time can also lead to food poisoning. An effective cleaning roster for your washroom, meals area and work environment is also a vital aspect of hygiene. Tables, cups and utensils, etc. should be cleaned after each meal period. Thoroughly wipe down draining boards, sinks and surface areas at least once a day. Floors should be swept and waste bins emptied daily so that rodents, cockroaches and other insects are not attracted. Try setting up a daily or weekly roster so that you will all take a turn at cleaning up. Floors, sanitary fittings, showers, toilets and urinals should be washed with water and disinfectant daily. It's also important to keep your work areas clean and tidy. Don't leave rubbish or food lying around, as this will attract rodents and other disease-carrying vermin. Make sure that waste refuse is removed at least once a day. Dry, clean clothing is another important aspect of personal hygiene. Clean your work clothes regularly. Dirty clothing can be a breeding ground for a harmful bacteria which could contaminate you. When changing out of your work clothes at the end of your shift, make sure they do not come in contact with your casual clothes. Personal protective equipment must also be cleaned and disinfected regularly, and this is especially the case if someone else apart from you has been using it. You are at your most infectious in the first 3 days after having caught a cold or flu virus, and sometimes even before you have become ill yourself. Try and limit your contact with others during this period. When recuperating, remember to drink plenty of fluid to avoid dehydration. Also, remember these important hygiene tips when you have a cold or the flu. Regularly wash your hands with soap and warm water. Avoid direct finger-to-nose contact. Hold it there. Don't forget to cover your mouth and nose when coughing or sneezing, and dispose of used tissues promptly. Also, make sure you don't share drinking vessels or eating utensils. Many people carry blood-borne infections without showing any visible symptoms, and indeed without even knowing it. In accident situations at your workplace, you therefore need to be aware of the dangers and follow these important guidelines. Firstly, assess the risks before rushing in. Always approach an accident scene with the underlying assumption that all human blood or other body fluids and tissues are potentially infectious. If the victim is conscious, then get them to apply bandages or contain the blood themselves. Wear disposable plastic or latex gloves, and if the blood or bodily fluids get in your eyes or mouth, then immediately wash these areas thoroughly. Proper eyewear will give you even better protection. If the victim requires CPR, then use a pocket respirator or resuscitation bag to prevent the passing of fluids. It's a good idea to have an infection control unit in your first aid kit, which should contain all of these important items. Also, try and keep a pair of plastic or latex gloves on you at all times, just in case. After dealing with the emergency, correct cleaning up procedures are vital. Remove your gloves by turning one glove inside out, and then with the exposed hand peel off the second glove from the inside so that the first glove is tucked inside the second. Then, immediately dispose of the gloves by placing them in an approved biohazard bag or container. Make sure you wash your hands thoroughly after removing your gloves. Also ensure that the contaminated work area or any contaminated tools are thoroughly washed with diluted bleach or disinfectant containing iodine, and that your cleaning items and gloves are subsequently disinfected. Any sharp or broken glass should be disposed of in a puncture-proof biohazard container, and remember to bring the container to the broken glass to avoid spillage. If you are part of the response team at your workplace, it may also be worthwhile getting vaccinated against hepatitis B. Probably the best way of protecting yourself from infection at work is to build up your resistance levels by maintaining a good level of fitness and a healthy, well-balanced diet. When was the last time you assessed your fitness level? What about your diet? Are you eating the right foods and the right quantity of food? To be effective, exercise must be done regularly. If you are over 35, or overweight, or have any doubt about your health, then make sure you consult your doctor before starting any exercise program. If you haven't exercised for a while, then always begin a fitness program gently. Then gradually increase your exercise period. Ideally, aerobic exercise such as brisk walking, jogging and swimming should be performed for a minimum of 20 minutes, 3 to 4 times per week. Are you getting this much exercise? Just remember, exercise doesn't have to be a drag. Any sort of activity is beneficial and it can be fun. It's a sobering thought, but you are basically what you eat. Try and enjoy a wide variety of nutritious foods. Eat plenty of cereal, grain products, vegetables, legumes and fruit. And eat in moderation lean meats, fish, eggs and low-fat dairy products. Remember to go easy on alcohol, and above all save your lungs and heart by giving up smoking. As we have seen, bacteria and viruses are the cause of most absenteeism from work. It's vital that you practice personal hygiene, both at work and at home, in order to limit the spread of infection. Also remember to be careful when you handle food. Keep your meals and washroom areas clean and disinfected. In an accident situation, carefully assess the risks before rushing in to assist a workmate. And remember that fitness and a healthy diet will give you even further protection and immunity from that ever-present army of germs.